Welcome to this educational video about pseudoexfoliation glaucoma, a specific type of glaucoma that can seriously threaten your vision. We'll delve into what it is, how it develops, and what can be done about it. Let's embark on this journey to understand this important eye condition. Pseudoexfoliation glaucoma, or PXG, arises secondary to pseudoexfoliation syndrome, or PS. PSS is characterized by the abnormal production and accumulation of a flaky, whitish material throughout the body, but most notably in the eye. While the exact cause of PS is still under investigation, genetics play a significant role. Specific genes, like LOXL1, have been strongly linked to its development, suggesting a hereditary predisposition. Environmental factors may also influence the onset and progression of the syndrome. The pathophysiology of PXG is complex. The pseudoexfoliative material accumulates in various parts of the eye, especially around the lens, iris, and trabecular meshwork, the eye's drainage system. This buildup obstructs the outflow of aqueous humor, the fluid that maintains healthy eye pressure. As the fluid can't drain properly, the intraocular pressure, or IOP, rises. This elevated pressure puts stress on the optic nerve, gradually damaging the nerve fibers responsible for transmitting visual information to the brain. Over time, this damage leads to irreversible vision loss, characteristic of glaucoma. Pseudoexfoliation syndrome is a relatively common condition, with prevalence varying significantly depending on geographic location and ethnicity. It's more prevalent in Scandinavian countries, among people of Northern European descent, and in certain populations in Asia. The prevalence increases with age, making older individuals more susceptible to developing both PXS and subsequently PXG. While PSS itself doesn't always lead to glaucoma, individuals with PXSS have a significantly higher risk of developing PXG compared to the general population. In the early stages, pseudoexfoliation glaucoma often presents with no noticeable symptoms. This is why it is often called the silent thief of sight. As the condition progresses, individuals may experience gradual peripheral vision loss, making it difficult to see objects to the side. Other symptoms can include blurred vision, halos around lights, and in advanced stages, tunnel vision. Sudden eye pain is less common in PXG compared to other types of glaucoma, but it can occur if the intraocular pressure rises very rapidly. Diagnosis of pseudoexfoliation glaucoma involves a comprehensive eye exam. The ophthalmologist will measure your intraocular pressure and examine the optic nerve for signs of damage. Gonioscopy, a special technique, is used to examine the drainage angle and observe any pseudoexfoliative material blocking the trabecular meshwork. Slit lamp microscopy allows for a detailed examination of the lens and other structures for the presence of the characteristic flaky material. Visual field testing assesses any peripheral vision loss. Optical coherence tomography, or OCT, provides detailed images of the optic nerve fibers to detect thinning or damage. Pseudoexfoliation glaucoma isn't typically classified into subtypes in the same way as some other glaucoma types. However, the severity of the glaucoma is categorized according to the amount of optic nerve damage, visual field loss, and level of intraocular pressure. The key distinction is the presence of the pseudoexfoliative material and its impact on the drainage angle, which differentiates it from other open-angle glaucomas. The primary goal of treatment is to lower the intraocular pressure and prevent further damage to the optic nerve. This is typically achieved through a combination of approaches. Eye drops, such as prostaglandin analogs, beta blockers, alpha-adrenergic agonists, and carbonic anhydrase inhibitors, are commonly prescribed to reduce fluid production or increase fluid outflow. Laser procedures, such as selective laser trabeculoplasty or laser peripheral iridotomy, can also improve drainage. In some cases, surgery, such as trabeculectomy or glaucoma drainage device implantation, may be necessary to create a new drainage pathway for the aqueous humor. Currently, there is no known way to prevent pseudoexfoliation syndrome itself. Because of the strong genetic association with the LOXL1 gene, research is underway to explore potential preventative therapies. However, early detection and management of pseudoexfoliation syndrome can significantly reduce the risk of developing pseudoexfoliation glaucoma. Regular eye exams, particularly for individuals with a family history of PXS or PXG, are crucial for early diagnosis and intervention. If PS is diagnosed, close monitoring of intraocular pressure is essential. The prognosis for pseudoexfoliation glaucoma varies depending on several factors, including the stage of the disease at diagnosis, the effectiveness of treatment, and individual patient characteristics. PXG tends to be more aggressive than primary open-angle glaucoma and often requires more intensive treatment. Recent research focuses on identifying genetic risk factors and developing new therapeutic targets to slow down the progression of the disease. Studies are also exploring novel drug delivery systems to improve the efficacy and reduce the side effects of glaucoma medications. While vision loss from glaucoma is currently irreversible, Ongoing research offers hope for future treatments that may protect and even restore vision.